Good afternoon, everyone. And I am Gursimran Singh, Program Associate, Spare India. And a very warm welcome to today's session. This is the third session in our webinar series on heatwave preparedness, multi-sectorial approach for resilience. This series organized by Spare India Academy in collaboration with NIDM and Vartman Mahavir Medical College and Safdarjung Hospital. Today's session is titled for protecting the most vulnerable uh, heatwave risk for pregnant women, infant, and children. In this session, we will discuss how heatwave affect the health of pregnant women, infant, and children, and persons with disability, and explore practical steps to better protect them. We are joined by experts from health, climate, and disaster response sectors. And we look forward to learn from their insights. And now, without taking much time, I would like to invite our moderator to take the session forward. Miss Nandini ma'am. Miss Nandini ma'am is a geographer and senior research at Science Connect with their expertise in environmental issues, livelihood, and science informations policies, informed policies. She's also has served as a chairperson of Science Tech Connect, so protecting data-driven solutions for the sustainability. Welcome, ma'am. Over to you, and thank you so much.
Thanks, Simran. Good afternoon, everyone. We all know, like other natural hazards, heatwave also doesn't impact equally in the society. Some are more vulnerable and at risk than others. Today, we'll know more about the differentiated vulnerability and risk factors, and also the inclusive planning issues from Ms. Atisha Sood, Consultant, Center for Disaster and Health, NIDM. May I request Ms. Atisha for delivering her speech? Let me first introduce her to you. Ms. Atisha Sood is a consultant in public health, currently leading the Center for Disaster and Health at the National Institute of Disaster Management, Ministry of Home Affairs, Government of India. In this role, she oversees disaster emergency and public health initiatives while contributing to the development of key policies, including the disaster management plan of the Ministry of Ayush, fostering resilience and well-being at the national level. Her work includes significant contributions to the National Chemical and Petrochemical Disaster Management Plan projects, supported by the Ministry of Chemical and Petrochemical. Previously, she worked on the health resilience and capacity building project supported by the World Health Organization, further strengthening India's disaster preparedness and response mechanism. Ma'am, you can start now your session.
Thank you.
You will have around 20 minutes for this discussion.
Okay, thank you, Dr. Nandini. Just let me share my screen. Let me know when you're able to see it. Is it visible now?
Yes.
Yes, ma'am.
Okay. So good afternoon, everyone. Today I'm honored to speak on a subject that lies very close to my subject area and my interest area, which lies at an intersection of public health, climate change, and social equity, which is understanding vulnerable population in the context of heat waves specifically, while we focus on pregnant women, infants, and children. With heat waves becoming more frequent and intense, it's very crucial that we pay focused attention to those who are most at risk and often at least visible in heat wave preparedness and response plans. So let us first understand who these most vulnerable populations are. When we talk about vulnerability to extreme heat, several groups of automatically come to our minds, which are elderly people with disabilities, person with chronic conditions, daily wage workers, and the urban poor. But today, my talk is specifically going to focus on pregnant women, infants, and young children. These groups are uniquely vulnerable due to the biological characteristics that they have, the social positioning of these groups in the society, as well as their dependency on others for care and protection. For example, when we talk of pregnant women, these are at special risk due to increased metabolic activity in their body due to the pregnancy that they are carrying, as well as various hormonal changes that they are going through. And overall, with the pregnancy, the women's core body temperature in itself rises to a point which is not normal in the human body. So heat exposure specifically during the pregnancy time can result in dehydration, preterm labor, and even low birth weight in the children of such pregnant women. And when we talk of infants and children, they have underdeveloped thermoregulation, wherein their body is not able to regulate temperature and adjust to heat as well as us adults can. So their system is like not developed fully, and they have higher core body temperature in itself, young children. So they are less able to like sweat or cool down and depend entirely on adults and their caregivers for hydration as well as shelter. And in many cases, these vulnerable groups coexist, such as young women who are at the brink of motherhood with infants, in turn like multiplying the exposure as well as the risk of these populations. And we need to ask ourselves, are our current health action plans, heat action plans, adequately protecting these special groups? Some other groups at risk are, as we talked about, elderly persons with disabilities, people who work outside for their daily wages, as well as the urban poor. And why are they vulnerable specifically? If we want to understand, then we can talk about that in two directions. One is by understanding the risk factors, and then understanding the exposure factors that are making these groups specifically vulnerable. It comes from a combination of both of these risks as well as the exposure. Risk factors specifically include various biological sensitivity factors like impaired thermal regulation in children and physiological stress during pregnancy, the lower dehydration risk, whereas as well as the high core temperature in pregnant women. Along with this, various pre-existing conditions such as anemia, malnutrition, or dehydration can also increase the risk of heat exposure in the vulnerable groups. And we can also see a lack of awareness about symptoms of heat stress and various ways that can help in preventing the heat stress in people. These are also some of the risk factors which increase the vulnerability of these groups specifically. There is also limited access to timely medical care in these groups, especially where the vulnerable groups are relying or staying in remote areas or underserved areas, for example, in urban slums, peri-urban areas, and those kind of places, right? And specifically for young children and infants, they are dependent on their caregivers for anything at all, for accessing health care, for cooling, for hydration, for taking care of them, for making sure they're not exposed to high heat. So they're entirely dependent on their caregivers for all of these things. And various exposure factors is crowded housing, slum conditions, poor ventilations in the slum or urban areas where such populations reside, as well as limited awareness and targeted early warning also is not very effective for such populations. For example, in poor housing conditions in urban slums or in rural areas specifically, there is a lack of ventilation. Tin roofs are often used in such areas because those are cheaply and easily available around the construction sites. So they are often used for housing, and which in turn increases the house temperatures, increasing the vulnerability of these populations much more. So exposure is also leading to higher vulnerability in these groups. Whereas and along with that, there is limited access to clean drinking water or cooling facilities at all. There's also work related exposure. For example, pregnant pregnant women who are working in informal labor or agricultural settings. They have no or very poor option to not work during the peak heat hours, right? And for children, the dependency on caregivers is very high, and that can link to a very high risk of heat stress and heat exposure. Then I want to introduce the idea of intersectionality uh, in terms of vulnerability, wherein this is a like a framework that can help us understand how multiple forms of vulnerabilities often overlap. They don't exist in silos, but they often overlap in various conditions. For example, if we consider a young woman, pregnant woman who is living in a crowded, low income settlement with no cooling, minimal access to healthcare, and working outdoors, is she's not just vulnerable, but she is multiply burdened. She can face gender based barriers in seeking healthcare because of the setting that she is in, economic pressure to continue working even in unsafe conditions, even in peak heat hours, where her body is not ideally should not be in that position, right? And there's also lack of support structure for her, particularly during emergencies. If we also want to understand the children risk of children, if we consider children with disabilities of uh, some migrant family with single mother, maybe in tribal or remote location, then their risk is not just one, it is compounded. Therefore, heatwave planning has to include and take into account not just what of the vulnerability, but also who, where, and why. And in considering all of these things, we can better we can have a targeted, context sensitive intervention for protecting our vulnerable populations, which can serve the whole idea of heat action planning, heat safety better and more effectively, right? Then why inclusive planning matters. So what does inclusive health heat wave planning actually look like? There are a few approaches that can make a real difference. For example, health system preparedness, maternal and child health clinics should be equipped with cooling mechanisms, shading waiting areas, and hydration stations, so that pregnant women are prioritized in early warning dissemination as well as the outreach program. And we can also use here community level action. For example, local frontline workers like ashas, anms, anganwadi workers, they can be trained to identify the heat related symptoms in women and children, and they can be also equipped with simple toolkits or response checklists where they can easily go into the society, look for these signs, and help women or children who are exposed to heat or may face some early signs of heat stress, so they can help in treating them initially and can further refer them to a medical facility or a healthcare facility further. And we can also think of integration of such plans with the flagship schemes. For example, programs like NHM, ICD programs, and the NPCCHS program of Ministry of Health and Family Welfare can integrate heatwave modules and advisories into their day-to-day operations. For example, NHM has so many vaccination drives, programs for pregnant women, for young mothers, and all of those people. They already have a lot of programs going on. So if we include heatwave in one of these flagship programs, so it would be easier to reach to these targeted vulnerable groups better and more effectively. And we can also think of social and behavioral change communication, wherein we include targeted messaging through trusted community channels like mobile alerts, posters at health centers, and maybe even door-to-door visits through ashas, ANMs who are trusted in the community, and they can help caregivers understand the warning signs and also take proactive measures for the vulnerable populations. And we can also make sure that cooling is accessible, wherein we can think of building public cooling shelter and hydration points that are located near maternity centers, Anganwadi centers, schools, as well as primary health facilities. It is also very important to remember that these aren't just health measures, they are life saving interventions when it comes to the most vulnerable. For example, young infants, young children. such small steps can help in saving lives, because these populations are very vulnerable. Even heat exposure, which is normal for an adult, these populations will not be able to bear it. It might lead to mortality in such vulnerable populations. So any step that we take in protecting these populations can have a multifold and very good result in protecting these populations, right? So I want to close my talk with this very statement, that the real test of resilience lies in how we protect those who are least able to protect themselves. Right? So heat waves are not an equal opportunity disasters. They expose and worsen the existing inequalities. Pregnant women, infants, and young children deserve focused attention in our heat action plans, preparedness frameworks, and risk communication strategies. As we scale up our response to climate related hazards, we must also scale up our equity and inclusion for them, because the strength of disaster resilience lies not in how we respond to an average citizen, but in how well we protect those who are most at risk. Thank you very much. This is my email ID if you want
Thanks,
to.
Miss.
Yes.
Thanks, Ms. Atisha, for your insightful discussion. You have nicely explained us everything. Thank you.
Okay, thank you.
Now I move to our second discussion. Dr. Rekha Shanmugam, Project Scientist, Faculty of Public Health, Sri Ramachandra Institute of Higher Education and Research, Chennai. I would like to request her to discuss on the heatwave impacts on pregnant women, physiological and gender perspective, mental health effect, risk of preterm birth, and gender barriers to care. Let me also introduce her to you. Dr. Rekha Shanmugam is a public health researcher with over 11 years of experience specializing in women's health and environmental exposure. She holds a PhD from Sri Ramachandra Institute of Higher Education and Research, where she currently serves as project scientist and co-leader, and co-leads the Wellcome Trust funded Heat in Pregnancy India project. Her pioneering doctoral research on occupational heat stress and pregnancy come-outs gained international recognition, including a feature in BBC World Health in 2024. With over 20 scientific publications, 450 plus citations, and numerous awards to her name, she is also an honorary research associate at Imperial College London. Dr. Shanmugam is committed to developing community-based interventions and training frontier health workers to protect mental health in the face of climate change. Miss, I request you to start your talk.
Yes. Thank you, Nandini, for a nice introduction. Let me start the topic heat wave impacts on pregnant women, a physiological and gender perspective. Actually, Atisha has set the stage for me. She has nicely explained who are vulnerable, what is heat, how it affects, what is the importance behind that, how these pregnant women are vulnerable. So it is now it is a easy job for me actually to continue, and my discussion will be more related to the evidences. She has told why they are vulnerable, how they are proceeding with the heat-related illnesses and everything, and who is going to protect them. So I'll be showing the evidences of what we have found in our own studies. Yes, climate change. Yeah, this is the headline in each talk globally. Of course, it is impacts the human both directly and indirectly. Let me give a short brief about it. According to the Intergovernmental Panel on Climate Change, South Asia is projected to experience a sharp increase in days with the temperatures exceeding 35 degrees centigrade. One second. with India among the top countries facing extreme heat risk. These events are expected to become more frequent and severe in the coming decades. Climate change also exacerbates the existing gender inequalities, limiting the ability of the women and marginalized groups to access resources and adapt effectively. Pregnant women are actually particularly vulnerable to extreme heat due to their physiological changes that make heat regulation more difficult, increasing the risk of adverse maternal fetal outcomes. Currently, around 70% of the women, especially pregnant women in the rural area, works in the informal sectors, often in hot and unregulated environments until their delivery. This continued exposure is dangerous actually, as pregnancy increases a woman's susceptibility to heat due to altered hormonal status and increased circulatory demands in order to protect their offsprings. These factors heightens the risk of heat-related illnesses for both mother and fetus. For example, in 2024, India faced one of its most severe heat waves on record, with temperatures soaring above 50 degrees centigrade in several regions. Official data from the Ministry of Health and Family Welfare reported 161 confirmed heat stroke deaths and 48,000 suspected cases nationwide. There are several discrepancies, highlight the challenges in data collection and the urgent need for improved heatwave preparedness and response measures, especially for the pregnant women. Is my screen is visible?
Yes, ma'am. Rekha, ma'am.
Hello?
Yes, ma'am. Your screen is visible, ma'am.
Okay, fine. Then what is meant by heat waves? Heat waves are defined as prolonged periods of excessively hot weather, often with high humidity, posing serious risk to human health and well-being. In India, the IMD defines a heat wave temperatures rise above 40 degrees centigrade in the plains, or when they exceed the normal by 4.5 degrees centigrade or even more. Heat waves not only strain power and water infrastructure, but severely affects those working outdoors and also the most vulnerable population, like pregnant women. With climate change, we are seeing an increase in the frequency, duration, and severity of these events. Heat waves affects especially the vulnerable population due to the inadequate thermal capacity. One of the survey conducted in India recently shows that nearly 63% of the women are working until the delivery due to their poor socioeconomic background.
Ma'am, can I stop you for a moment? Your
Yeah.
slides are not changing. Yeah, it's changing now.
Now it is changing. Yeah.
Thank you, ma'am. Thank you, ma'am. You can proceed.
Actually, pregnancy is actually a remarkable journey. The health of the mother and fetus can be affected by various external factors, but one such factor is the ambient temperature. Pregnant women are especially vulnerable due to increased metabolic workload and also the reduced ability to regulate the body temperature. Many women are likely to work during their reproductive age and continue to work until their childbirth, especially in the lower and middle income countries. Maternal hypothermia appears to increase the incidence of spontaneous abortions in the early trimesters. In addition, it may cause fetal malformation as organogenesis begins in the first trimester. Because the first trimester is the crucial period for organ development. If the body is deprived of the fluids in the later trimesters, it becomes dehydrated, which causes blood volume to decrease, and that in turn increases the oxytocin, the hormone which is responsible for contraction, and it may cause premature labor, that is preterm birth. Heating raises the metabolic burden and alters the maternal physiology, restricting the fetus' ability to meet its growing physiological need, which may cause IUGR or low birth weight. A Climate Central study showed that between 2020 and 2024, India experienced an average of 6 additional pregnancy heat risk days each and every year. These are the days where extreme temperatures increase the risk of preterm births especially. These are few studies which actually evidences that heat impacts on pregnant women. The global scenario says a few studies has been conducted in Western countries in relation to ambient heat exposures, and it impacts on maternal and fetal outcomes, and found various adverse pregnancy outcomes such as miscarriages, preeclampsia, hypertension, gestational diabetes, preterm births, low birth weight, and so on, stillbirth, and so on, and even fetal strain. Working pregnant women have even higher vulnerabilities, and except for one study in Gambia, no other study has been conducted. And our study happens to be the first study in India, which we have conducted between 2018 to 2021 in Tamil Nadu. The theory explains that this is how the heat impacts the pregnant women. The combination of external heat and internal heat causes maternal heat strain, as the susceptibility is high during pregnancy due to hormonal status, immune system, thermoregulation, and increased metabolism. If the woman is exposed to high heat, cutaneous vasodilatation is stimulated and the blood supply to the skin increases, which decreases the blood supply to placenta, the organ which supplies blood, oxygen, and nutrients to the baby, and other internal organs. If this continues, sweating may increase, and which may finally lead to dehydration. These are the heat strain symptoms due to heat exposure, such as rise in skin temperature, core body temperature. Core body temperature is nothing but the internal vital organ temperature, sweating, osmolality, and reduction in body water, weight, and changes in urine volume and color. If the heat dissipation is less, the maternal heat strain will be higher during pregnancy, causes adverse pregnancy outcomes. As the fetal balance is totally dependent on the maternal temperature and uterine blood flow, fetal strain occurs, and further it leads to other complications such as birth defects and neurological impairments. This is the methodology we used to conduct our study. The first monitor is the WBGT monitor, which actually measures the area and environmental heat stress. Then second one is the infrared thermometer, which actually measures the core body temperature with the help of tympanic membrane temperature. Then fourth one is the refractometer, which actually helps to measure the urine specific gravity. The third one is the hot tubs questionnaire, which we used to capture the perception data. This box plot actually represents the attribute WBGT profile of the workplaces. WBGT was measured throughout the shift. The dark line actually indicates the TLV limit for heavy workload, and the dotted line indicates the ACGH TLV limit for the moderate workload. The minimum WBGT recorded was around 26.4 degree, and the maximum was 38. The minimum WBGT recorded in the lower WBGT profile area was nearly 20 degree, and the maximum was 29 degree. Both the TLV line actually shows that in the most of the workplaces, the recorded WBGT was above the TLV limit, and indicates that 3/4 of the women were working beyond the safe limit. Here are the results of the adverse pregnancy outcome study, the findings from our own study. This showed that we observed a positive association between occupational heat exposure and adverse pregnancy outcomes. In the third trimester, women with heat exposure to above TLV WBGTs had 3.5 times risk of adverse pregnancy outcomes, the composite of miscarriage, stillbirth, IUGR, preterm birth, and low birth weight, after adjusting for the confounders. The prevalence of miscarriage was 9.5% versus 2.7%, and a composite of preterm birth, stillbirth, IUGR, and birth defect was 21.7%. Pregnant women in the first trimester exposed to above TLV had a 3.8-fold risk of miscarriages and 2.7-fold risk of adverse birth outcomes. This statistical results evidences that the heat exposure is one of the risk factors for the pregnant women. These are all the publication evidences out of our own study. If it is required, I'll share the links of these publications with you all. Many pregnant women, especially those working in the vulnerable conditions, actually faces significant challenges beyond the heat exposure. They often experience loss of wages due to lack of sanitation facilities and have no access to sick leave or paid leaves, which forces them to work even when they are unwell. Limited or no access to medical care and health insurance further increases their health risk. Social instability, language barriers, and poor transportation options make it more harder for them to seek help or proper health care. Additionally, They have long working hours, leave a little time for the nutritious meal, leading to malnutrition and further impacting the both maternal and the fetal health. In addition, there are certain co-risks like sexual harassments, insect bites, snake bites in the temporary shelters, and violence and crime may occur. The statistical evidence that the self-reported heat-related symptoms occur frequently in the women without having toilet access during when they work in the heat zones. The behavioral changes of these women further leads to complications, especially during the heat waves. Due to inadequate toilet access, they used to refrain from drinking adequate water, actually aggravates the symptoms of dehydration while working in heat. These are all the gender barriers to care. There are few cultural norms sometimes which limits the pregnant women freedom to travel alone, which intensified during the heat waves when accessing distant health facilities. Then heat-related symptoms like fatigue, headache, nausea, vomiting, dizziness may be underreported or ignored due to their gender norms and dependence on male approval and delayed care seeking occurs. Limited awareness of heat stress risk during pregnancy result in delayed recognition and responses because of low literacy level, then a lack of clean and accessible toilets making more managing hydration and hygiene difficult. Due to inadequate sanitation facilities, and sometimes the social expectations such as domestic and agricultural jobs may continue and uninterrupted despite heat, as women are often expected to endure without any complaint. Finally, the fear of judgment. Sometimes these pregnant women may suppress their symptoms and they will not let out their feelings out and in order to avoid care due to social stigma. However, there are certain gaps in making policy recommendations in LMICs. Now we have less data due to lack of appropriate gender-specific documentation. Sometimes in the heat action adaptation plan has to be upgraded with the specific protective measures for the pregnant women and the child. However, there are research gaps and knowledge gaps in understanding the symptoms of heat-related illnesses are there among the grassroots level PHC staffs like ANMs, VHNs, community health nurse, and Anganwadi workers. So proper documentation of HRIs may not happen sometimes. In addition, the maternal care protocol should be integrated in heat action plans nationally. Then even though our Indian government is allocating adequate funds for the MCH benefits, some funds may not be reached fully. If these gaps are fulfilled, then the protection of the vulnerable population may be slightly easier. There are certain recommendations. There are certain recommendations we provided both to the workplace management and also to the pregnant women to protect themselves from heat stress. The workplace should have the basic amenities like adequate drinking water facility and temporary portable toilets to relieve themselves, which can reduce the absenteeism and increase the productivity and income of the managements. As the women should have adequate training on heat prevention methods, we recommended the importance of rest breaks under shades, cooling interventions like body cooling, wet towels, cool showers, and the reason for wearing loose clothes, loose fitting clothes, which may speeding evaporation. Additionally, for the pregnant women, the recognition of HRI symptoms should be explained to them in order to prevent from heat strain, and the advice about the seeking of yearly medical advice if they are unwell as given. And also as a women, they have to grow the healthier future generation. So they have to take well-balanced diet, which is more essential. So they need superior protection to cope up with heat stress and especially during the heat wave period. How to strengthen the heat action plans? There are certain measures like adequate financing, then establishing legal foundations, accountability, promoting a participatory approach, taking a long-term perspectives of the issues to strengthen the HAPs. The literature evidences shows that nearly 70% of the women continue working while pregnant, especially in the rural India. So in order to protect these women, we can strengthen the HAPs to protect the pregnant women by adequate funding opportunities, formulating policies, rules, laws, and review mechanisms has to be happened. Then co-designing the interventions by involving the stakeholders and in order to plan the future for them. There is no proper health insurance to cover the heat-related illnesses, less maternity benefits for working women in the informal sector, such as agriculture, brick industry, salt pan industry, construction industries, etc. Recently, our study has been featured in BBC World Health Story and also a few other magazines like Sunday Times and Southwest. These are all the evidences for that. So coming to the conclusion, the final conclusion is that heat stress is also considered to be the one of the risk factors for the adverse pregnancy outcomes during the heat wave period. It also underscores the public health concerns, the necessity of conducting extensive cohort studies to comprehend the susceptibility of biological mechanism to heat. It is important to protect the future generation. It is imperative to establish gender-sensitive legislations and workplace interventions in order to safeguard the reproductive health of millions of women workers. In this field, we continue to do future research, which is to explore the biological pathway and underlying factors, to explore the mechanisms behind the adverse pregnancy outcomes and the heat waves. So we conduct a multi-institutional collaborative project in order to further understand the mechanistic pathway behind this. Then this is the acknowledgement, and I acknowledge the Department of EHE, Faculty of Public Health here, and the Department of Science and Technology for funding our study, then NIH Global Center for supporting my study, and workplace managements and all the participants. Thank you very much. Now I'm happy to answer the questions. Am I audible?
Yes, ma'am. Nandini, ma'am. Ma'am, Nandini, ma'am, your voice is. Ma'am, you are not audible. Nandini, ma'am.
Yeah, she could.
Hello, Nandini, ma'am. Ma'am, your voice is not. Uh, Meanwhile, thank you so much, ma'am, Rekha, ma'am, for your insights, and we will move further. Ma'am is trying to say something. Hello, Nandini, ma'am. Ma'am, your voice is not coming. Just a second, I check with ma'am, and meanwhile, we forward the session. Now, I would like to invite Sneha Kumari, ma'am, for their insight. For like, introduce ma'am.
Okay. I'm sorry. I think I had some internet issue and I couldn't unmute. Anyway, thanks, Ms. Rekha ji, for your nice discussion and insightful, and you provided us very nice, very insightful discussion. Now I move to Dr. Sneha Kumari ji. In fact, infants and young children also lie in the most vulnerable groups due to their physical condition. Now I request our third discussant, Dr. Sneha Kumari ji, Assistant Professor, Community Medicine, VMMC and HGS, to discuss on the impact of heat stress on infants and young children, and also to focus on evidence-based caregiving responses. Let me first introduce her to you. Dr. Sneha Kumari is a medical doctor and public health expert with over a decade of experience in community medical. She holds an MBBS, DGO, and MD in community medicine. She is a gold medalist in her MD degree. And she also has DNB and MBA in hospital administration. Currently serving as assistant professor in the Department of Community Medicine at VMMC and Safdarganj Hospital, New Delhi. She has previously held faculty positions at several reputed medical institutions. Dr. Kumari has presented over 40 scientific papers and posters at national and international forums and has authored more than 35 peer-reviewed publications, along with contributing to key public health books. Her core interests lie in maternal and child health and reproductive health care. Ma'am, you can start your talk now.
Yes, ma'am. Thank you for nice introduction. First of all, good afternoon to all of you. Now, many things have already been discussed about the vulnerability of heat-related illness among some important groups. Now, one group which is the most important, as they are the future generation of our country and our world. So talking about infants and young children, just understanding heat sensitivity and health risk among them. Next slide, please. Yeah. Before discussion has already been discussed by in previous presentation that heat waves, what do we understand by heat wave? According to meteorological organization, when daily maximum temperature exceeds the normal temperature by 5 degrees Celsius at a particular location for more than 5 consecutive days, the condition is known as a heat wave. So these are some of the newspaper cuttings which shows that year by year the trend of heat wave is increasing all over world and specifically in our country, that everyone is affected from these heat waves. Next slide, please. Next slide, please. Yeah, you can also, you must have read one newspaper report that have come some days back, that India's heat waves could break human survivability limit as per World Bank report. It states that by 2030, India may account for 24 million of projected 80 million global job losses from heat stress. It reveals that not only from the health point of view, but also from the economic point of view, our country will be lagging in just production, in producing just GDP, and also as per the survivability limit, it will decrease due to increasing heat waves in our country. Next slide, please. These are some of the newspapers headings which we often read in previous some years about the increasing heat waves. Next slide, please. I am just discussing these things because we can understand that there is a rising trend of heat waves in India, and it affects our lives in various dimensions. So the rising trend of number of intense heat waves events in the recent 2 decades of 21st century has been vaguely attributed to global warming. Climate change has increased possibility of severe extreme weather, including heat wave events. These waves in summer and heavy spells of rainfall when it is least expected have almost become the norm in India. We often think, कभी कभार हम सोचते हैं कि मार्च में बारिश क्यों हो रही है, अगस्त में बारिश क्यों हो रही है, इतना लंबा गर्मी हमें सितंबर अक्टूबर में भी, अक्टूबर तक भी हमें ठंड क्यों नहीं लगती है. So these climate changes has influenced our lives in a many ways. So the impact of rising temperatures and increasing frequency, duration and intensity of hot spells in India poses a challenge to human safety and sustainability for its 1.4 billion population. Next slide, please. These have already been discussed in our previous presentation, that this is the trend which we are having. Death rates due to heat waves year by year, it is increasing. Next slide, please. Now, we have just understand broadly about heat waves and what are its impacts in our country. Now we will just focus on this topic, that what are the effects of heat waves among infants and young children. Why to focus on them? Because these are that vulnerable group which cannot complain their symptoms, which cannot see their problems or their pains, they cannot say. We have to understand, or our caregivers should pay attention that what problems they are having, or what signs and symptoms they have to look in them, so that they can be saved from this hazardous situation of heat waves. Next slide, please. Before discussion in details, just look at some statistics reports. What does it say? That newspapers headlines we often read. The Times of India reported on May, just last year only, that 2024, that 2 infants aged 15 and 10 days died from suspected heat-related illness in Ahmedabad. The Indian Express has reported the same incident on the same day. Other reports indicate multiple deaths in different states, including Bihar, Jharkhand, Madhya Pradesh, and Rajasthan. A report from Hindustan Times mentioned that a heat wave in Bihar led to the death of 71 people, including some children. NPR reported on June 17 that a 6-month-old baby died in New Delhi due to extreme heat. So these are some of the preventable casualties that we can prevent if timely and adequately care should be given to these infants and children. Next slide, please. Further statistics also reveals that in India, study shows that heat waves can have a significant impact on infants and young child health, including potentially increasing mortality rate. While some studies suggest a link also, a 2019 study from Varanasi indicated that this age group was particularly vulnerable. Additionally, research which was published in Elsevier suggests that 2 out of 1,000 infants in India may die due to high temperatures during pregnancy. So these are some of the tragic situations which we are having due to extreme level of heat waves. Next slide, please. So now we try to understand that what are the impact of heat waves on newborns or younger children, why they are vulnerable. So, newborns and younger children have increased risk of dehydration and electrolyte imbalance. Why is it so? That already told by Atisha, that it is due to their underdeveloped thermoregulatory system. It means they are not having the developed thermoregulatory system, which includes sweating, which includes perspiration. They are in the development phase. And so these are not up to just facing the extreme level of heat waves. Second point is that there is high surface area to body mass ratio that leads to increased risk of dehydration and electrolyte imbalance among them. Next slide, please. During heat waves, newborns are at risk of excessive sweating, which lead to rapid fluid loss and electrolyte imbalance. Further, their kidney functions are not mature enough, so they may not be able to efficiently regulate electrolyte levels in the body, just thus further increasing the risk of complications among them. Next slide, please. Then depletion of essential electrolyte can have serious consequences among newborns, causes weakness, irritability, seizures. In advanced cases, they can suffer from cardiac arrhythmias and organ dysfunction, and finally to death. Next slide, please. When exposed to high temperatures, newborn can quickly become overheated, leading to hyperthermia. You must have read about or heard about hypothermia or hyperthermia is quite common among newborns or younger children. And hypothermia, to reduce hypothermia, we have several programs. We have kangaroo mother care. We have baby friendly hospitals. But what about hyperthermia? Hyperthermia, when exposed to high temperature, newborn can develop it, a condition characterized by an elevated body temperature. This can manifest as symptoms such as fever, irritability, lethargy, rapid breathing, and in severe cases, seizures. Hyperthermia can progress rapidly and result in heat exhaustion or heat stroke if not addressed promptly. It means these are the further complications of in the form of heat exhaustion or heat stroke. Next slide, please. Heat exhaustion is a milder form of heat-related illness that can occur when the body is unable to cool itself effectively. Symptoms of heat exhaustion in newborns may include excessive sweating, cool and clammy skin, nausea and vomiting. If left untreated, heat exhaustion can progress to heat stroke, a more severe condition characterized by dangerously high body temperature, confusion, rapid heart rate, and loss of consciousness. Next slide, please. Consequences of heat waves not managed appropriately and timely. In some cases, it also exacerbates this respiratory problems in newborns. As we already know that air pollution is affecting most of our states, and along with heat waves, along with air pollution, deterioration in quality of air, that leads to increased respiratory problems among newborns also, and that can lead to increased risk of respiratory distress, so that they can have a higher risk of sudden infant death syndrome sets. The combination of high temperature, humidity, and poor air quality can place a strain on an infant's immature respiratory system, making it harder for them to breathe properly. Next slide, please. Why newborns faces dreaded respiratory symptoms? One question arises in mind, that why newborns? Why should we focus on newborn for this respiratory symptoms? Because they are due to their smaller airways and underdeveloped respiratory muscles. As a consequence, newborns may experience symptoms such as labored breathing, wheezing, coughing, and apnea. These respiratory difficulties can lead to serious complications and even be life-threatening if not addressed properly. Next slide, please. Now we have just understood the problem burden, what are the different health impact among newborn and children. Now, how the next question arises, that what are the solutions for this, and what are the management of these heat-related illnesses among infants and young children, what we can do. So, next slide, please. we will just discuss some of the common conditions which arises due to heat waves. Most common symptoms which you often encountered in your lives, that is heat rash or melia rubra or prickly heat. You can see that your newborn or younger children are having these heat rashes. So what are the treatment? Place in a cool environment, remove excess clothing, just the norms which are applicable for adults, it is applicable for children also. Always try to wear, always try to make them wear cotton clothes, not polyester or any other fabric clothes, because it will cause heat related illness among them. So avoid application of lotions. Prevention, how you can prevent that: use loose fitting clothing, cotton clothing, and remove excess clothes, make them comfortable. Avoid direct sunlight, avoid excessive heat, frequent breastfeeding of fluids. One of the myth, as I am from community medicine, so I always talk about community, that often community people or mothers from community think that whenever the child is ill, don't breastfeed that child. Just wait, if he will recover, then they will provide breastfeeding. This is a myth, because always, if a breastfeeding child is there, then always breastfeed in case of any type of illness, because your breastfeed will help the infant baby to recover fast. So, and one of the common thing which we often observe, that babies are nowadays wearing diapers. So diapers should be avoided during these seasons, because already there is so much heat wave, so much heat surrounding our environment. If the baby is continuously wearing diapers, then that can also lead to heat rashes and prickly heat among them. So next slide, please. Next symptom the babies are having, that is excessive irritability and dehydration. So treatment and prevention should be that: place if mild level is there, so place in a cool environment, remove excess clothing as discussed previously, frequent breastfeeding of fluids, and if mild dehydration is there, then only it can be treated at home. But if moderate and severe degree of dehydration is there, you have to immediately report to your nearest healthcare facility, because dehydration can always lead to coma and several dreaded complications. So only mild dehydration you have to treat at home by taking physician's consultation only. Next slide, please. Now, one of the dreaded condition from heat waves or heat-related illness, that is heat syncope. What is it? It is seen with prolonged standing in hot environments that causes vasodilatation and a fall in blood pressure due to venous pooling in the legs, which causes a decrease in venous return to the heart, causing a fall in cardiac output, resulting in fainting or feeling lightheaded. As you have heard or noticed that if the children are going to schools में अगर उनका prayer हो रहा, assembly हो रहा, and it is in open ground in these days, then some children वो खड़े खड़े वो अपन prayer करते करते they fall down, वो गिर जाते हैं. So it is because of heat syncope, it is because of heat radiation, increase heat waves that are coming. So in these days, school administration always try to shift their working hours, or to have online classes, so that they can be saved from these heat waves or increased heat temperature. Online system is a very wonderful system which has mostly utilized after COVID-19 days, so it can be applied during these days just to prevent our kids. So what are the prevention and treatment? Remove the child from a hot environment, oral rehydration with salt containing fluids. If ORS is not there, then you can also give lassi, nimbu pani, lime water with salt and sugar, coconut water, sattu can be given. Next slide, please. Heat exhaustion. After prolonged heat exposure, the body temperature rises up to 104 degree Fahrenheit and lead to dehydration, tachycardia, vomiting, fatigue and headache with normal mental status. It requires admission as specialist care. Immediate admission is required in this case. How will you treat this case? Treat this case, doesn't mean that you treat by your own, but just traveling to a nearest healthcare facility, what you can do at your level. This is being told that remove the child from a hot environment, oral rehydration fluid should be given, intensive care monitoring and IV rehydration at nearest healthcare facility, and rule out sepsis. These can be undertaken at the healthcare facility. Next slide, please. Now, heat stroke. Prolonged exposure to heat leads to core body temperature rising to more than equal to 40 degrees Fahrenheit. Patient present with what are their symptoms? Coma, drowsiness, confusion, delirium, hallucination, seizures, anhidrosis, coagulopathy, multi-organ dysfunction. Now, what are the treatment we are having for heat stroke? First, you have to consult your nearby healthcare center just to be getting admission of that kid. Then ABC protocol should be maintained, that check airway, breathing, circulation, give oxygen, IV fluids, and several other biochemical tests should be done to just give immediate care and treatment to that infant or younger children. Next slide, please. Next slide, please. So these are some of the common conditions or some of the dreaded conditions that arises due to heat waves not properly managed or taken care of. Now, what does caregivers should pay attention for their kids, for their infants or younger children? That danger signs, they have to identify the danger signs which can arise in their infants or younger children. Those are refusal to feed. First symptom, first sign which you have to see in your child whenever they are in any trouble. They refuse to feed, either breastfeeding or if they are on complementary feeding, or if they are on normal feeding, they refuse the meals which you are giving previously, and they used to take very conveniently those meals. Now they don't want to eat anything. This is the first sign in case of children or infants that they are in some trouble. Next sign is excessive irritability. Excessive irritability means they are very irritable. They are continuously crying. They are not playful. They are not active. These are the signs. Now, decreased urine output. Decreased urine output. How will you assess in case of infants? Decreased urine output can be checked if the child is wearing undergarments. Then how many times undergarment is being changed due to urination, or if he or she is wearing diapers, how many diapers are being changed during the daytime or during the night time. So these are some of the signs that you will look in your infants or children, just to have an idea that what are their hydration status. But it is advisable that these days don't make them wear diapers. Now, next danger sign is dry oral mucosa and absence of tear or sunken eyes. Or sunken eyes is present. Dry oral, their lips are cracked, their angles of mouth are having infection, and their face are so pale. So these are some of the signs which you have to look for checking the hydration status in infants. Lethargy and altered sensorium, they are not willing to play, they are not active. Next sign is seizures. In advanced cases or complicated cases, they may have seizures, bleeding from any side. And if these danger signs are present in your infants, you have to seek immediate medical help if danger signs are present. Next slide, please. These the main thing is that to prevent our infants and young children from these heat waves and prevent mortality arising due to heat related illness is to create awareness. So awareness generation is the need of the hour, and many IEC material are available on UNICEF sites, on MOHW sites, on NCDC sites, many IEC materials. So then, and most of these conditions are arising in those children who are undernourished child, who are malnourished child, who are living in slum areas, whose parents are lower socioeconomic strata. So these conditions always arises in those people who have not any awareness level about how to prevent their children from heat related illness. Next slide, please. These are some of the informative material which should be displayed at schools, at slums, at community areas, just to make them aware. Next slide, please. Before ending this conversation, some of the nice initiatives which are being taken by some of the governments, by some of the states, that you should check water intake of your child or of your infant. You always, as we often see in our community, that people don't know about the ease of complementary feeding in their children. They continue breastfeeding till 1 year, till 1.5 year, and they forget to give them water along with breastfeeding. So awareness generation about exclusive breastfeeding till 6 months. After 6 months you have to give water. So these are some of the common myths which are present in our community, to make them aware about that they need water after 6 months, frequent water after 6 months, and you have to just give them water to drink, because the infants and younger children are not aware that they have to drink water. Some of the nice initiative which was started in Japan, that in their schools they are having water bell system. What is that water bell system? It means during the whole hour of school timing, they rang the school bell 3 times, and that bell is specifically for drinking water. You have to drink water, and this thing is also implemented in some of the states of our India also. So some of the nice initiatives at schools, at homes, can prevent these mortalities from heat related illness among infants and younger children. Thank you.
Thanks, Nehaji, for informing us in detail about the health risk of the infants and young children due to heat wave, and also the presented nicely about the management and caregiving issues, and also the awareness issues. Thank you so much. Now I move to our last discussant for the day, Mr. Rohit Magotra ji. He is the Deputy Director of IRADE. I would like to request him to talk about policy issues and designing inclusive heat action plans issues, considering gender sensitivity, disability issues. Let me also introduce him to you. Mr. Rohit Magotra ji is the Deputy Director of Integrated Research and Action for Development, a pioneer South Asian think tank. With over 23 years of experience, he has led pioneering research and action projects on agriculture, energy, climate adaptation, disaster management, and urban climate resilience. A leading expert on heat stress and its socioeconomic impacts, Mr. Magotra has been instrumental in developing gender-sensitive heat stress action plans for Indian and South Asian cities, supported by IDRC and APM. He has trained public institutions, developed multilingual manuals, and led stakeholder workshops across the region. He presented sessions at COP27 and is a founding member of the South Asia Heat Health Information Network, accredited by WHO and WMO. In 2024, he joined the NIDM Technical Committee to revise India's heat wave mitigation guideline, and currently leads efforts to enhance heat early warning systems with the India Meteorological Department. Now I go to Mr. Rohitji.
Thank you so much for inviting me. Though I was traveling, I'm in Bangkok at the moment, and I just finished one session on the gender transformative heat action plan. What the subject is so close to me, so I decided I have to join this. So when we are talking about any instruments for heat action plan, see, the most critical part is that how do we have the vulnerability, because the vulnerability is critical for taking the actions. What lacks the current heat action plans is that we don't have a detailed understanding of the vulnerability, and that vulnerability also is not a static subject, because what could be not vulnerable in the previous year may be vulnerable in the current year. So to give an example, that for example, if there is a woman who is staying in a slum, and she was married last year, and she's in the slum, she's a pregnant now, so which means that her vulnerability, given her living conditions in the low income settlements, the slums, and also being pregnant, so she becomes a vulnerable. So that's one thing which I want to highlight, that we should not uh, take vulnerability as a static subject, because vulnerability is something where you need to regularly update the same. And the so is case with the disability or with the comorbidity, in terms of the health conditions of the people which may change. Maybe previously they were not diagnosed with uh, let's say diabetes or high blood pressure or kidney ailment. So that is where when we are talking about the heat action plans which are targeting the vulnerable groups, we have to understand the dimensions of the vulnerability. The vulnerability is also not limited to one particular group. It also shifts within the city. So for example, if one particular area where earlier there was no such risk. So let's say there was a construction activity which is going on for developing a building or developing a factory, so which means that the vulnerability has aroused there because of the kind of settings which has changed, the kind of activity which is happening over there. So my key message is that don't consider that the vulnerability just exists with the low income groups, and so though they are vulnerable, but even when we look at the factors of the ultra vulnerability, so we have to also include the populations which are homeless, which are disabled, which are old age women, and without any caregiving, the infants, all these groups are ultra vulnerable. And when you are talking about the people who are poor, so that's make it all the more vulnerable. So this is one dimension. So when we are designing our heat action plans, we need to look at that. When we are planning our heat action plans, we need to understand and assess that what are the factors which are causing the vulnerability. The cities which we have worked with and studied, the vulnerability factors may vary. For example, water is a critical component for vulnerability when we are talking about let's say low income group settlements in Rajkot. What that changes, if we look at, so geography which has even a good water supply, which doesn't have like a regular electricity, so that becomes then another component of the vulnerability. So there are also infrastructure services, which are provision to the communities, in absence of which they become more vulnerable. If they have no water, if there are no regular water supply, if they have limited electricity, and they're living in an environment where the kind of housing conditions are not adaptive to the heat, which is the case with most of the low income group settlements. So a lot of the another dimension is the provision of the infrastructure services, which includes your healthcare facilities, which includes your water supply, which includes your electricity, which also includes the availability of the wash infrastructure. So this is another dimension of the vulnerability. So while we are designing any such plan, there is a need to not plan just because on the numbers of how many males and how many females in the population, and that's not what should drive the vulnerability kind of analysis. We have to look at the kind of occupations they are doing. If we're talking about the groups, so it's the vulnerability of the heat waves is not restricted to the outdoor workers. It's also the indoor workers, because the kind of environmental settings they have within their houses because of lack of fan, a lack of water. So all those factors are also like worsen the vulnerability. So the third important point which I want to make is that when we are talking about understanding that where our populations are who are most vulnerable, it is very important to identify these groups and where do they live. So it's important to use digital tools like GIS to identify where these populations are, characterize that what is causing the vulnerability, and accordingly the interventions should not be limited to generating awareness. And it's a lot more than generating awareness. It's also providing them the early warning, how to interpret early warning. So there's a lot of gaps which exist in terms of people actually receiving an early warning on the heat waves. So there are only 5% of the population who actually receives heat wave related early warning. So how can you actually design and implement an inclusive heat action plan when you only have 5% of the population who actually understands or receives your early warning on the heat? So when we are designing inclusive heat action plan, so it's important to actually look at in heat action plan for all 4 stages, which is in terms of design. So while you're designing these heat action plans, these need to be community consulted and community participative heat action plans, where the design elements are coming from the priorities of the vulnerable groups, the low income groups which are most vulnerable. The second part is when we are actually kind of planning, so there is a need to have a inclusive approach, which is not looking at just from the heat health but also from the other sectors which are important for for reducing the vulnerability, which means that we the water supply department, your power department, you have education department, you have the garden and park infrastructure department. So all of these are critical to actually enable you to implement your heat action plan. And then comes the monitoring and evaluation. So that is where we also need to capture that which are the groups which are being getting most impacted due to the heat, and accordingly also kind of review which strategies are working and which strategies are not working. So it's a process. It doesn't end at a point of just developing an heat action plan as per the guidelines which are provided by the National Disaster Management Authority. What the key component is that unless we engage and involve the communities which are most impacted by the heat, by actually bringing all the stakeholders together who are crucial for implementation of these heat action plans, and regularly monitor and document the impacts of these heat action plan in the communities, and also enable the mechanisms which actually provide both relief and preventive mechanisms for these communities, then only we can actually think of inclusive heat action plans. So they have to be locally led, where the lot of the principles of locally led adaptation has to be there to be inclusive, and most of and of all the above, you have to have a woman participation, which is very critical for designing these heat action plans. So while it has to be a kind of both technologies like GIS, which will help you to understand where the most where the urban heat islands are, where my vulnerability is, and understanding what are the factors which are causing the vulnerability and addressing them. So it's not the responsibility of only health department to kind of to anchor and deliver the heat action plans, but a lot of it is also oriented towards the infrastructure, enabling either cooling centers for these populations, also looking at proofing the water supply, improving their housing designs, and of all these measures, it needs to be a very integrated manner has to be delivered, and that's how we intend to kind of design heat action plans, implement it, and the very important point is that we need to learn each year and update these action plans. As I said, that the vulnerability is not static, it's dynamic. It will change from one year to another due to several factors, because of the activities, because of any other emergencies, and also because of several other socioeconomic factors which should drive it. So that's all. I'll stop here. Open to questions, if any, by the participants. Thank you.
Thanks, Ruji, for your valuable discussion. Today, from our 4 discussants, we came to know a number of very important issues covering health impacts of heat wave on the most vulnerable groups, including pregnant women, infant and children, their caregiving responses, their preparedness issues, and also different aspects of designing heat action plan. Our guests have discussed it in such a comprehensive way that certainly it has enhanced our understanding and will help us to formulate our future action plan regarding heat wave. In conclusion, I would like to wrap up everything by mentioning that we cannot stop natural hazards, but with taking proper mitigation efforts, we can reduce partially the severity of certain kind of hazard like heat wave. For example, if we can increase tree cover or forested land area, that can straightaway reduce the ambient temperature up to 2 to 4 degrees Celsius. At the same time, from the social and behavioral aspect, by providing timely early warning messages with better preparedness and adaptation efforts, finding innovation solution using appropriate data, science and technology, and adequately being backed up by institutional framework, we can lessen the vulnerability to a great extent and reduce the sufferings of the most vulnerable and protect them. I would like to thank all our discussants. Now I'm going to our audience for taking specific questions, and I request our guests to answer that. You can either raise your hands or unmute yourselves to ask your questions. Simran, would you please unmute Aniruddha?
Hello. Hello, am I audible?
Yes.
Okay. So I have written uh, 2 points, but both are the same. Regarding vulnerability, the first guest speaker, she was talking, but that kind of physical vulnerability is always there. And what the last speaker also said uh, about the dimensions and all. So I was trying to understand, but the thing is that the social vulnerabilities, there are many. Like during summer, when heat increases, mostly people are depending on groundwater in the cities, and uh, in the villages also people are depending on groundwater, but they have either they are going to their neighbor's house or it's different. But the approach in urban areas is uh, totally different. Like they people go to uh, common resources, so common hand pump, common tube well, whatever it is. So these are actually installed by commissioned by the government, local government, and um, I don't know about maintenance. Sometimes these are maintained, sometimes these are not. However, during summer, these are actually this aquifer level, so it behaves differently. So aquifer this water level goes down, and because of that, water from the source, from the tube well, so the flow of water is very low. Sometimes it's not coming. Sometimes some of the common tube wells, the common borewells, so these are actually condemned. So this is a reason for conflict. We have been talking about conflict, we have been talking about peace building and everything. But these are the social issues even the government should take into account. Should take into account. At least in the, I don't know, the solution in a nutshell, it is very difficult to say. We need to study these things first, and what people's choices are there should be taken into account, and then it can be suggested. Okay, thank you.
Do you have any specific questions, Aniruddha?
This
Or
is
it was
specific question is about the vulnerability, because this vulnerability has never not been addressed by the speakers. So this is also actually increasing vulnerability, and at the same time, the specific question may be having specific question, may not be. So you have to specify as moderator that in some cases um, this is a this raises conflicting situations. So that is why it needs to be addressed. So that is the, it's not in a question form, but we can make it in a question form. Thank you.
okay. Then should I request Rohit ji to discuss more about it?
Yeah, no, I think the question is good and very important, because I touched upon that it's not alone the condition of the people, which is determining the vulnerability, but also the availability of the water, the availability of the electricity. So while we are looking at, that the summer, the water scarcity is an important factor which actually drives the vulnerability. But that's where we are saying that if we are making these heat action plans, then we need to identify that which are the factors which are causing the vulnerability. I'll talk about an example from Rajkot city, where we find that in some settlements, it's the the water frequency is only twice a week. So while this issue was identified, that this vulnerability was identified, that water is causing the vulnerability in the high temperature conditions. So thereby, the helpline was initiated where people could actually get the water tanker available on the call. And so that is the other dimension, is that we have to also look at the long term proofing mechanism, so that the water scarcity is being actually addressed and planned. So it's not that during heat we start some firefighting, but if we are making a plan, we have to see that what is the kind of a water demand is there, and we have to ensure that those arrangements are made, and also prioritize, like as I said, that the vulnerability is not uniform. And as a government, it's important to address the requirements and the needs of the most vulnerable communities. So if we have that kind of a vulnerability being identified, and we know that which are the locations, which are the groups which are getting affected by the same, so thereby the provision of this infrastructure services, which includes water, electricity, health services, so that needs to be ensured. So that's where, this is an example that we are doing an inclusive planning, and when we are not just looking at that water availability in high income groups areas and middle income groups is ensured, what where it is required most is ensured as a part of the planning process. Thank you.
Yes, Rohitji. Hello.
Yes, please.
Hello. Rohitji, thank you for sharing your views. It is really, your approaches are good. But I have 2 points. One thing is that uh, sensitizing the government, the authorities. This is a kind of an advocacy and something. And at the same time, sensitizing the communities also on water security issues and social cohesion, how to maintain. So these are very important issues. I believe that can minimize the risks, because we are talking about impacts, and the impacts are there, and it will be there, it will increase, it will not decrease. uh, so my point is that if we can do something, if we can think of some sensitization programs, so
Yes, yes.
that is my
You're
suggestion.
right. You're totally right. I think while on the one hand, we have a government who is actually doing the planning, what given that if community is not being sensitized and oriented, so that also has to be significantly addressed by the local governments and the local leaders and the community based organization. So I think it's a very important point which you have raised. Yes.
Thank
Now, are there more questions from our participants? If there is no more questions, now I invite Mr. Simran for delivering his vote of thanks. And with that, we'll end our today's session. Thank you. Simran, you are not audible.
Am I audible now?
Yes.
Yeah, thank you so much. So thank you so much for joining us today's session, and a very big thanks to our speakers for their sharing their insight, and to our moderator also to lead the discussion so well, and finally thanks to all of the participants, your time and your interest. And we will have more webinar, as I mentioned in the first. It is a series. It is a series of webinar on heat wave preparedness, and we will more webinar on this topic and many other related topic also. If you have any question, any feedback, any suggestion, please feel free to write to us, and stay tuned our social media channel for regular update for Square India Academy, and stay safe. Take care. Thank you so much. Thank you so much, Roy sir.
Thank you.
Thank
Thank you.
you so much, sir. Thank you so much, ma'am. Thank you, ma'am.